Thank you, Susan. Our next speaker is such an amazing young man. I'm not going to say too much to introduce him because I know he has a wonderful talk already prepared. Neil Sen was diagnosed with ALL and is Philadelphia chromosome positive back in July of 2003. He was the second pediatric patient to receive an expanded stem cell transplant approximately 16 months ago. Neil's going to talk to us about his experience, and then I think maybe afterwards his dad might have a few words to say too. Welcome, Neil.
All right.
Good afternoon. Welcome to the second annual Bone Marrow Transplant Survivor Day. I'm Neil Sen, and this is my dad.
Okay.
I was delighted when asked to share my thoughts on my transplant experience at this meeting. Thinking about what to say, a series of mixed emotions came to my mind, including profound sadness for the kids that ended their journey too soon, joy for the kids that went home after completing treatments, and so many stories of struggle and triumph. I believe no matter how difficult the diseases are, in most cases, there are survivors. For cancer patients, it is safe to measure survivorship in spirit rather than age. The very word survivor is a projection of hope, endurance, and human spirit. A little bit of history about my disease. About 2 years ago, at the age of 12, I was diagnosed with acute lymphocytic leukemia with a chromosomal translocation. It is a rare form of leukemia with poor prognosis. A few nights of intermittent fever led to the dreadful diagnosis. My journey with cancer started in July of 2003 in a Dallas hospital. 2 months-long chemotherapy did not hold much hope for my survival. I was rapidly running out of options. My cancer cells kept on growing through the treatment. I came to M.D.Anderson in September of 2003 and immediately felt the difference. The care I received at this hospital is unparalleled. Overall, the atmosphere of hope and can-do spirit have made my journey easier. The dedication and expertise of the physicians and the support personnel has elated me to a level to hope for life again. We were told that stem cell transplant actually provides the best chance for my life. This course of treatment was a journey by itself and a great challenge for my body and mind. I pondered and visualized all the good times we had before becoming a cancer patient to keep me motivated. Daily prayers, positive thinking, and playing video games kept me happy. Also, child life activities, school assignments, and children art project drawings kept me occupied. After remission from a chemotherapy protocol and a preparative phase, I received an expanded cord blood transplant last year. At the time of transplant, I was the second pediatric patient to receive an expanded cord blood at this hospital. During the transplant, I was confined to my room for 68 days. I did not feel like eating or drinking, much less taking my medications. However, with the help of nursing staff and my dad's constant persistence, I managed to do the right thing most of the time. My transplant experience was not easy. I had a fair share of trouble. I caught a nasty RSV pneumonia and survived. The treatment for my RSV infection was quite intense. I was put inside a plastic tent for 16 hours a day and inhaled the medication for 3 weeks. No one was allowed to visit me during that treatment. I was on isolation, and the loneliness was mind-numbing at times. I also had endless infections and acute graft-versus-host disease. But today, I am alive, well, and hope to continue the trend if God permits.